Hello everyone, my name is Fan Su. Today we will present a research paper that investigates cardiovascular risk factors among outpatients in a developing country. The main question of this study is how common are cardiovascular risk factors in this population, and how serious is their future risk of heart disease? This question is important because cardiovascular diseases are now the leading cause of death worldwide, especially in low and middle income countries. By understanding these risk factors early, healthcare providers can better prevent serious diseases like heart attacks and strokes.
So hello everyone, my name is Fariia. So now let's look at the population in this study. So actually the researcher include 292 outpatients from a hospital in Mali and in country called Sub-Saharan Africa. So these patients were between 25 to 70 years old and with an average age of about 46 years, and about 60% of them were women, and this sample represent adults who are already seeking medical care, which makes it useful for understanding real-world health conditions. However, since it's hospital-based, it may not fully represent the general population.
This study was a cross-sectional survey conducted over several months in 2017. The researchers collected both clinical and laboratory data from each patient. This included measurements like blood pressure, blood sugar, cholesterol levels, and body mass index. They also recorded lifestyle factors such as smoking and alcohol use. To estimate future cardiovascular risk, they used two models, the Framingham Risk Score and the SCORE system. These tools calculate the chance of having a heart-related event within the next 10 years based on a person's health data.
Actually, the results show that cardiovascular risk factors are very common in this group. For example, about 36.6% had a high blood pressure, and 21.6% had high blood sugar. 23.6% had a metabolic syndrome. When looking at the future risk, the average 10 years risk was about 26%. And using one model, the researchers also used a statistical test to compare groups. For example, and they found that people over 50 had a much higher risk than younger people, and the p-value for this comparison was less than 0.001. And in this sample, term, so this means that difference is very unlikely to be due to chance, and so we can trust that age is strongly related to higher risk.
In conclusion, the study shows that the cardiovascular risk factors are increasing in developing countries, which reflects a shift from infectious diseases to chronic diseases. The findings suggest that early screening and prevention strategies are very important. In real life, this means people should monitor their blood pressure, maintain a healthy weight, and avoid smoking. For those in the cardiovascular technology field, this research highlights the importance of diagnostic tools, patient monitoring, and risk assessment systems. It also shows the need for better healthcare policies and education to reduce long-term disease risk. Thank you for your attention. Hello everyone, I'm Fan Su. Good morning everyone, today we will... No, that's okay.